Perfect. We can see the screen.
Okay, great. Well, I was just saying thank you so much for having us here today. We're so happy to be a part of this great resource. Mark, Diana, and I are so thrilled to talk to you about how Operation Smile Canada, as a global medical charity, was able to leverage our almost 40 years of medical knowledge, expertise, and innovation in dealing with the COVID-19 pandemic. COVID certainly presented a challenge in maintaining our high standards for operations, but they were challenges that we felt prepared to face head-on through our experiences in the field. In this presentation, we will discuss our three-tiered response to dealing with the pandemic. This will begin with a discussion of our in-office strategies and procedures, virtual tools, and return to the workplace protocol. We will then move on to a discussion of how we manage an expansive national network of donors, community volunteers, and Canadian medical mission volunteers, many of whom are currently serving on the front lines of the pandemic. Finally, we will conclude by highlighting a few components of our international response to the global pandemic and how, as an organization, we are managing to maintain as many of our programs to the highest standard that we can, while still assisting our program countries in their fight against the virus. Before I dive in, I wanted to provide some context as to what Operation Smile actually does. Founded in 1982 by Bill and Kathy McGee, a plastic surgeon and nurse duo, Operation Smile is a global medical charity helping to improve the health and lives of children in more than 60 countries. We've provided more than 300,000 children and young adults born with cleft lip, cleft palate, and other facial differences with free, life-changing surgical procedures and dental care. We train doctors and local medical professionals, ship donated medical equipment and supplies, and provide year-round medical treatments through a network of comprehensive care centers. Last year alone, over 19,000 patients received surgery and dental care at medical programs in 32 countries. Aside from conducting surgeries, we also trained more than 3,000 healthcare workers through conferences, workshops, and hands-on courses. Finally, we operate 31 care centers across 16 countries and make year-round treatments available to our patients. Now, while the headquarters for our Canadian Foundation is located in downtown Toronto, we also have two full-time staff located outside of Toronto, one in Ottawa and one in Vancouver. We also have a network of medical and community volunteers that span from one end of the country to the other. This setup provided us with ample experience and training in regards to functioning online. We host weekly Zoom meetings. We currently use Microsoft Teams and previously had been using Skype. And we have lots of phone calls with lots of volunteers, which is really, really great. We also have experience in staying connected with groups virtually in other countries, and this includes our care centers like the one in Bolivia or our partner country foundation, the one in South Africa. Discussions on COVID-19 began in our office as early as January. We went over what COVID actually was, proper hand washing techniques, and I'm happy to say that some of our staff have actually been on medications or even in our operating rooms observing surgeries. So quite a few of us actually have experience on keeping a space sterile and to the standard of pre-operative cleanliness. And this is one example of how we were able to employ as a global medical charity during this time. We recognized early the potential threat of this virus and developed an open line of communication concerning it early on in the office in order to keep our colleagues informed. For the last 3 months, we've been working virtually and staying connected during weekly meetings. This is a really great time for us to share uplifting moments, success stories, and have troubleshooting discussions concerning tech or anything else. We recognize the potential impact being distance may have on the staff's mental health and enacted various engagement initiatives to encourage everyone to stay well and to stay upbeat. So this started by theming our weekly Zoom meetings, and we did all sorts of things. We had, I think, first a formal one, which I quite enjoyed. We did a dispo, stripes, bring your pet, stuffed animals work day, which is actually the image that you see on screen. As well, Mark, our CEO, who's also on this panel, has hosted a 3-minute Zumba class over Zoom, and this encouraged staff to get active during the workday. We also host a weekly half-hour coffee break on Friday afternoons in order to encourage everyone to take a break and connect with our peers before the weekend. We always encourage walks and breaks, and we have an open door policy to discuss struggles and challenges. And in my experience, senior leadership is very good about doing regular check-ins to make sure that everyone is doing okay and has everything they need to continue operating. We offer support and flexibility to staff with children in regards to workspaces or working hours, and have even had the privilege of encouraging our staff's kids to participate in meetings sometimes. This looks like a child reading her mother's updates at a staff meeting, or sometimes the person that I check in with brings their daughter. It's always a really lovely moment to be able to say hi and involve them in what we're doing. In terms of re-entering the workplace, we have several guidelines that are super important. The first and foremost, our standard is always to stay home if you are sick. The health and wellness of the staff has always been a priority for Operation Smile Canada. We fully believe that if you can't take care of yourself, you won't be able to take care of others. We are asking staff to wear masks to and from the office, and if it is imperative to have guests visit the office during this time, there will be masks provided for them. We will all conduct daily and regular cleanups of our personal spaces as well as communal spaces, and there will be absolutely no sharing of equipment or resources. This includes pens, computers, chairs, and especially any soft materials. We will do temperature checks at the door or ask that staff do temperature checks at home if they are able to. We ask that in the early stages, if one of our staff members needs to go to the office, that they check with the office manager first to ensure there won't be people in the office at once. We ask that all employees wash their hands before entering the office and then sanitize their hands when they reach the desk. But the great news is that a lot of our desks are already distanced, and some have some sort of barricade, whether this is a door to an office or a sliding door on a cubicle. For those who do not, like mine, we will provide a plexiglass barrier on the desk, like the one that you can see on the screen here. We will have bacterial wipes and hand sanitizer provided throughout the office, and masks will be made available to staff members if they do not have their own. We will also have proper hand washing technique signs throughout the office. We also invite the staff to participate in an ongoing discussion, either in our group meetings or privately with the person that they check in with, to voice what they feel they would need to function in the workspace. And this is so important to us to make sure that everyone has a voice and feels comfortable returning to the office. I'm now going to pass this discussion off to Diana, who will be speaking about our national response to dealing with the COVID-19 pandemic on a national level.
Oh, one sec, Diana. I think you're on mute on your end. I've unmuted you. Can you hear?
I can't hear anything.
Yeah. Really, Mark? Okay.
I haven't heard Mary at all. I'm just worried that I'm not.
Oh no, yeah, I did get your message, and it's my recommendation is to unplug your mic and plug it back in. I'd say refresh, but we don't want to interrupt the session. Hold on, everybody. We're just having some audio challenges here, but we were gonna be back in. Okay, we refreshed. Mark, can you hear? Thumbs up if you can or you can't. Hang on, everybody, just a short moment here.
Still nothing.
Still nothing. We can hear you okay. Maybe unplug your microphone actually out of the jack and then plug it in again. This is a good opportunity for everyone to take a sip of their coffee while we just iron this out. Mark, can you hear us now? Mark, can you hear us now? I don't think so. Mark, if you can delete your browser, if you can log out, if you can hear me, Mark, if you can log out and then delete your browser history and then reload back on, that would be great. But maybe Diana can proceed while you do that and then log back in. Would that be okay? You can't hear us. Okay. Thank you, Diana.
I'm just corresponding via text, so I'll just go ahead and hopefully Mark will get his audio sorted for his portion. But yes, I was saying while I was on mute that I'm really excited to be here, and thank you so much for this opportunity. I get to work with Mark, Dan, and Dale. It's always a pleasure. So as part of my role, I engage 130 medical volunteers, and this ranges from our wonderful nurses to our surgeons to anesthesiologists and pediatricians, and the list goes on. And while our medical missions are currently suspended due to COVID-19, most of our volunteers are actually frontline workers right here in Canada. And so since the start of the pandemic, we've actually had numerous touch points with our medical volunteers. They're a part of our family, and so we always want to make sure that they are okay, and especially during this unprecedented time, it was really important for us to reach out and get a pulse and see how they were doing. And at the beginning, they, again, it's unprecedented, so they were trying to prepare as much as they can and trying to get as much PPE as possible and prepare their hospitals in order to handle this pandemic in a safe and effective way. And you'll notice on the screen there, the lady on the left, her name is Kelly Raymond. She's from Edmonton, Alberta. She's one of our child life specialists, and this is a really important position on our medical mission, but also a role in Canada, which helps prepare children and families to overcome some of life's most difficult health challenges and events, including COVID-19. So you'll notice a mustache just on her mask. So, Kelly, she works with children, and so this is obviously a scary time for a lot of families and especially kids. Not knowing what's happening. So she tried to lighten the mood in our hospital and provided little mustaches for her and her colleagues, which was really nice. And then on the right of the screen is one of our pre and post-operative nurse volunteers. Her name's Linda. She works at Sick Kids Hospital here in Toronto. And you'll notice Linda's wearing an Operation Smile branded scrub cap, and as part of our touch point with our medical volunteers, one thing that we asked them was, what are you in need of? And one of the things they mentioned was scrub caps, and so we happen to have a stockpile in our office, and we recognized that they weren't being utilized or helpful in any capacity just sitting on our shelves. So we ended up mailing them out with a handwritten thank you card to all of our medical volunteers on the front lines. And we recognize the need for PPE even in our own country in Canada. So we were able to help in that way on a national level. And showing gratitude and appreciation to our volunteers is always something that we have at the forefront. So we've done some recognition pieces on our social media, through e-blasts, and through phone calls, as Mary mentioned. Next slide, please. Thank you. So in this photo is another one of our nurses. Her name is Candice Melinda. She's been an operations volunteer nurse for the past 4 years. She's from Calgary, Alberta. And during this time, Candice has been on about 15 of our medical missions in the past 4 years. She's been with us. And her last mission was actually out in Morocco, which was our first all-female mission. And it was back in February, beginning of March, when the pandemic just really started to have legs coming west over to North America. And so we had to quickly respond by rearranging her flight schedules along with other volunteers who were at that particular site and a couple of other sites. And so as airports were quickly starting to close or stop flights through certain hubs, it was really tricky to navigate that and try to get our volunteers home, but they were all safe, and luckily none of them had contracted the virus, which is a great thing. And after serving on the front lines for about 2 months in Canada, when things were starting to flatten in Alberta, Candice really felt that she needed to help in Italy. And so she actually served with another organization called Samaritan's Purse. And she went to Italy in one of the hardest hit regions. And she was there for 3 weeks volunteering her time. as she does with our organization as well. And she was able to help make what was a bad situation better. And she told us that it was as bad as it was portrayed in the media, but all that they did need was extra helping hands. So we're really proud of Candice and all of our medical volunteers for really putting their lives at risk for not only Canadians, but other people around the world. And Candice's story received attention from Operation Smile's co-founders, Dr. Bill and Kathy McGee, and they promptly recorded a thank you video to Candice, and we also posted it on our social media accounts for everybody to see. And our volunteers are a huge part of what we do. We can't carry out our mission without them and without our donor partners as well. But volunteers specifically donate their time about half a month every time they go out on a medical mission. And they also pay a team fee as well. So they help us to subsidize some the expenses incurred as well. And lastly, on a national level, with regards to our community partners, our donor partners, our medical volunteers, and our non-medical volunteers, we had circulated a really heartfelt letter from our global Chief Medical Officer, Dr. Ruben Ayala. You can see him in the photo there with a child on one of our medical missions. But he mentioned that the safety of patients, caregivers, volunteer staff, supporters, and partners in each of our communities around the world has always been and will continue to be our top priority. And on June 6, 2020, after careful consideration of the information produced by international health agencies and consultations with our partners where we work, we decided to suspend all of our international travel for volunteers who were to serve on Operation Smile programs and activities. And this suspension set out by Operation Smile actually came before Canada began to suspend its international flights. So we recognized really quickly that we needed to suspend our operations for the safety of everyone involved. You can read the full article from Dr. Ayala in our virtual booth. You can download it there. And while this news was really tough for our medical volunteers to hear, because it does take months of planning to get our volunteers out on a medical mission, they completely understood our decision, and even to this day they do reach out and say how much they're excited to go back out on the field, of course when it's safe to do so, because a lot of our work involves face-to-face interaction, from conducting our medical missions to supporting our students within their schools here in Canada. We had to act really quickly to determine what we could do virtually that we used to do face-to-face. And while we aren't conducting our medical missions at the moment, training and education is a huge component of who we are and our organization. And so some of our Canadians are involved with some training and development, which also includes curriculum building for our local volunteers who might not have the same training and certifications that we do here in Canada. So they're helping to build local healthcare systems and capacity at the moment in light of COVID-19, and with our community ambassadors and student volunteers, fundraising events for our Longest Day of Smiles movement, for example, which is we're celebrating this upcoming Saturday, went from in-person events such as marathons and runs to virtual events, so virtual walks, virtual runs, what used to be in-person bake sales and other type awareness building events became online trivia and tournaments, for example. We had to think of creative ways to continue to engage various groups of supporters so that we can still work toward our goal. And while, in Canada, we're flattening the COVID curve, our cleft curve continues to grow in the countries that we work in, with more than 300 children born daily with a cleft condition around the world. So we have a lot of work to do when we get back out there.
Thank you, Diana. That's great.
Okay, it's me. Can you hear me? That's the first question. Yes,
Yes.
thank you. Yeah,
Yeah.
okay. Hi, everyone, and thanks for joining our call today. You heard a lot from Diane and Mary, and I've got a few slides to quickly run through. I understand that our great moderator, Marla, is going to cut me off when I need to. So Mary's already on cue here, and we're going to get really, this is an important slide because it really talks to what we have to do globally as healthcare practitioners is to raise the awareness that if you look at the purple slide here, that more people each year die from the lack of access to safe surgery than from malaria, TB, and HIV/AIDS combined. This is a really important stat, and this is why we're in this business. We're not just here to deliver a cleft lip or cleft palate surgery or all the comprehensive care that goes around it. Imagine the 38 to 40 years that we've been spending with Operation Smile volunteers, transferring education and building the capacity around the world in these low and middle income countries where there's now safe access to surgery sites. And we have to, as a global community, really stress this to our governments that this become a priority. Right now, with the current situation with COVID, none of our essential surgeries are happening around the world. And what that means is that other surgeries are also not happening around the world. If it wasn't for Operation Smile and some other like-minded health-related NGO, INGO charities out there, could you imagine how some of these countries are facing COVID if it wasn't for organizations like ours that were there on the ground? So we just want to really emphasize the importance that we have to start looking at access to basic surgery as a fundamental right for individuals around the world. Mary, if we can go to the next slide, please. This is what we were able to do. Actually, one more up. It was the, nope, next one. Thank you. I'm going to skip this one over. This is what we did in a very short period of time. So as Mary and Diana were speaking, while we turned on a dime to keep our business activity running, our charitable business and purposes running, the second we were sent out of our offices, we were in an emergency response action plan. And within that period, you can just see on the slide here of all the number of personal protective equipment and supplies that we were able to literally get out to local healthcare providers in these countries because Operation Smile had warehouses ready for their next surgical mission that was happening. So thank goodness we have generous volunteers around the world and generous donors that were able to just say, get out there and get this equipment in the hands of our healthcare practitioners and our hospitals so that we can literally deliver on our promise to keep people safe during this time of a pandemic outbreak. In places like Ecuador, in Ghana, in Madagascar, we were there and able to equip people with the PPE that they needed immediately. Next slide, please. So you can see that in our phase 2 response, what we're really doing now is assessing the needs of our communities that we're serving to find out in particular what they need now to be able to get back to work in delivering safe surgery, not just for the cleft conditions that we're serving, but delivering safe surgery. What's that going to look like? If any of you have seen our infomercials on TV, you'll see a large group of people gathering for a mission, sometimes up to 300 of them, and we never want to turn anyone away. But we now have already started processes where we can pre-screen, where we can bring people in just almost like if we were going in for elective surgery here, so that we can ensure the safety of both the patient and those family members that are coming in so that we can deliver safe, high quality surgery. Mary, next slide. We have hospital partnerships throughout the world that enable us to be innovative, that enable our partners to be able to deliver care based on the unique circumstances that each of these low and middle income country healthcare systems have. And our focus, while is on cleft care, really is to strengthen the infrastructure of the health systems in which we're delivering. So behind a smile, behind a child's smile, what you really see is the infrastructure for delivering quality healthcare and surgical performance and delivery by volunteers that we have trained and credentialed. And for those of you that may not know, the standards of surgical care that's set out by the World Health Organization were standards that were set by our co-founders and Ruben Ayala, our Chief Medical Officer, and other partners. So we're on the executive for the Surgical Standards Committee of the World Health Organization. Next slide. This is the fun one. What you can do today while you're at this virtual conference is help us spread smiles. And it's easy. The longest day of smiles is coming up on the on Saturday, the 20th. It's the longest day of the year. And this initiative really has been championed over the last few years. And we have many ways you can get involved. You can text SMILE to 45678 right now, and an automatic $10 donation goes onto your cell bill. And you can also, if you want to give a bit more, you can go to operationsmile.ca. You'll see the longest day on the homepage. Just click to give, click to get involved. We can't thank you enough for being part of this movement. It is exciting to be with other healthcare providers. And I want to personally thank each and every one of you before we go to questions for everything that you're doing to keep our communities safe throughout the world. And anytime you want to get involved with Operation Smile, we're here to help. We're always here to be welcoming new members into our family. So thanks so much for your time today.
We want to thank you, Marion, Diana, and Mark, and for sharing these amazing initiatives at Operation Smile Canada. It's amazing what you do. And also thank you for your resilience and getting back on and making a wonderful presentation. We're opening the session to some questions. We did have one about operations overseas. I'm just going to share my screen. And just, we have a few minutes for this. I don't know if you can see it, but if there's, one question was, has operations overseas resumed with the medical volunteers? And if so, how were you able to deal with the pandemic affecting it?
Thank you. Yes. So for many of you that may be tracking COVID-19 throughout the world, many of you were maybe surprised as we were to see on how quickly Vietnam was controlled and contained COVID-19 spread, with it being so close to where one of the epicenters laid. So we have had our team at Vietnam actually incubate for us some local missions to practice on how we are going to be able to deliver safe surgery. So we've had a couple of local, what we call small incubated sessions there, where screening is done with social distancing in mind, with proper PPE and testing prior to any patients and families coming in. We have heard that our Morocco team is getting ready for their stage of possibly starting some local surgery initiatives. And once I also heard this morning that our colleagues in China are actually starting to look to local initiatives. As Diana may have alluded to, we have 6,000 volunteers around the world, and many of them thankfully have been trained and credentialed in the local countries where they're from. So the good news is that until our international teams are still waiting to go out, we can start where it's safe to do so. I would predict probably in the fall, we're going to see more activity happening. Great question. Thank you for asking.
Excellent. That's it for any questions. But if you want to, again, I was really intrigued by the longest day of smiles. I know it's coming up.
Sure.
So how does one volunteer for that? How does one get involved with that?
Well, it's easy to get involved. You can see that there's different ways when you go to our website. We have a peer-to-peer tool on the website where you can sign up and actually raise money with your family and friends. You can see Mary on the screen here. So, and she's smiling. Mary's been great at setting people up for those fundraising pages. And we are encouraging people really to just get involved by making a gift. If you can make a gift by texting SMILE to 45678, that's the easiest. The next step, if you want to give more, is to go to operationsmile.ca. There's a donate button there. And the exciting news is that we have a donor partner who's with a family. They live in British Columbia. And that's all as far as I'm going to go in terms of disclosure. They want to remain anonymous, but they've committed $50,000 to match the first 50 that comes in through this initiative. So we know we're going to raise at least $100,000. I know for a fact, because I've been on the website, we're up to almost 300,000, I think, Mary, and we're going to start to see some growth. When I'm not on these calls, I'm on calls with donors right now to encourage them to get behind the longest day of smiles. And I just want to encourage the country, especially during the time of COVID-19 and everything that's going on around us, there isn't a better time to smile and feel good. And I want to, maybe if I can end this just with a little bit of history of probably why we're so pumped to be working with this great charity. Operation SMILE was built on the fundamental principle of philanthropy. And that pure meaning means the love of human kindness. And whenever a child needs us in the world, we deliver that loving care and support for as long as the child and family needs us. And our partners and our volunteers enable us to deliver that complete care effectively and efficiently. And it's partners like your group in terms of the Public Services Health and Safety Association. We can get your employees involved through our Smile Blanket Challenge, where you can make a team, 4 or 5 people can work together and create a baby blanket. We have all the materials and the designs for you. And then you can put a tag on that and we'll hand deliver that blanket to a waiting child who's just going to come out of surgery. And that'll be the first thing that the baby or the child is wrapped up in. Our promise since 1982, when Dr. Bill and Kathy McGee made that our first surgical mission in the Philippines, almost 40 years ago, it remains stronger than ever. Every 3 minutes, a child is born with a cleft condition. That's 1 in 700 live births. And that happens even during the time of a pandemic. So what we're seeing now is the wait lists that we've always seen have now gotten longer. We know through the delivery of a new model of safe surgery that we're going to be implementing post-COVID means that fewer people will be coming to our missions. We'll have to do more missions. And each of those surgeries that we're doing is going to cost more. Even through the donated goods, all of our sutures, all of our equipment is donated free of charge by Johnson & Johnson family of practice for medical devices. All the sutures that the kids are stitched with, free of charge. All of the volunteer surgeons and nurses, anesthesiologists, all of that doesn't cost money, but there are costs involved. And with surgeries now becoming smaller and more refined and distant, we're going to have to pay more in order for these children to get the smile that they deserve. So we can't thank you enough for allowing us this platform. And I know Mary will be at the booth with some of our other colleagues virtually. I'm sorry that we had some technical issues, but I think we got everything covered, and we just can't thank you enough for being part of our Smile family, because once you get connected with us, we know where you are. So thanks again.
Well, thanks too. And